This discussion will focus on examples of co-building social transformation while applying the CARE model to a particular project. First, we will fuse CARE with a practice model of suicide prevention. Please note I am only fusing one framework with CARE in this example. It is certainly possible to take relevant components of several models in order to co-build a particular social transformation project. While exploring these examples, reflect on how you might approach your work, open to synthesizing and fusing models or parts of models and frameworks to fit your situation. We will now segue for a moment to reflect on perceptions of reality, which I think is appropriate in part of our discussion. As we see, the big R contains the global ideas about a particular subject, and the small r is our personal lens on what the big R offers us to address a particular problem. Each of us has a perspective, and the richness of sharing supports the concept that the sum of the parts intending a solution to a problem is greater than the individual perspectives. This is indeed a central element of co-building. The example that follows is about clinical social work practice. However, it can be extrapolated to our current conversation regarding co-building transformation that takes into account many voices. Along with this idea, I want you to consider what I call the big R and little r reality. It's kind of a metaphor, but I think it makes sense in terms of what we're looking at and how you would bring about you'd extrapolate certain theories into your practice. When talking about the big R with regard to evidence-based clinical social work theory, I'm discussing the global level. That is, the place where all theories and possibilities are contained. This I call the big R. In other words, this would be the global container of all possible theories that one might use with clients. And as you see, the hands indicate what we're going to next, that I call the small r reality, where individuals who have particular perspectives take from the global ideas into their own practice. The small r, and that is the level at which each of us develops our own ideas and therapeutic style as we extrapolate from the big R what works for us in our practice. So here would be an example of yourself having extrapolated from the big R those elements that you want to use in your practice, and then here you are with the client in practice actually utilizing what you've elected to adapt. So this sort of parallels this idea of the hologram, and so that's the reason I'm showing this picture of the hologram, because that sort of depicts what the big R may be like in terms of depicting it. It contains all of the possibilities. It's kind of the global approach to whatever we may be talking about. Specifically, in this case, it's evidence-based clinical social work theory. Then the next image here, the hologram it's said that if you break a hologram into 1 million pieces, each of the broken shards together can reconstruct the whole. And so that is like, the shards would be like each of us individually with our perspective on the big R. In other words, each of us has a different way of seeing that reality based on our life experience and our understandings of the world around us. Parts to the whole and whole to the parts. Most of us have preferences as to the way we view problem solving. Some of us prefer to look at the parts of the puzzle, while others prefer to view from the lens of the global perspective or whole picture. It is helpful using the container of the big R to visualize both the parts and the whole. In many situations, services develop over time from the parts approach to the problem. A problem is seen and a specific solution is developed. However, most problems are multifaceted, and there is a bigger picture impacting individuals, groups, communities, and organizations. We will first focus on the parts to the whole perspective. Over time, several mental health agencies were developed that are in these two counties. Some are multiple locations of one agency. In this image, there are many probable overlapping services in some agencies or among some agencies, and a lack of services in some areas of the counties. As you see, there are large areas of land where nothing is available. So when perceiving responses to a problem, individuals develop strategies that address the problems that are pieces to a much larger puzzle. It is like me hugging the redwood tree. When we are in the forest, we see the trees. However, To get a handle on the whole picture, it is helpful to shift perspective. The whole to the parts or global perspective is where we perceive what is available in the environment to address an issue. What already exists most likely does not include all the possibilities that may be needed to address the issue. In visioning the bigger picture or the whole, it is helpful to see what gaps exist in services. For instance, there are large areas without services according to the maps. In most areas there are diverse communities with different needs and various levels of services. Clearly there are places where access to services are non-existent, as we see in this map here. One challenge is to discover where underserved communities are located and to elicit input from citizens about their suggestions regarding needs that require services to address problems. These two lenses upon which to view issues help us bring together a more whole picture when we look at the parts to the whole and the whole to the parts, and then seek input from those members of the community that live in both areas that we are working with. Now, keeping in mind our different perspectives, we will next move to examining elements from the big R as we co-build towards transformation. It is important to remember that as many voices as possible be shared related to those affected by whatever the transformation is upon which we are working. The following example of weaving frameworks together comes from the care model fused with a comprehensive treatment model. As you explore this co-building example with me, think about how you might co-build a social transformation plan. Remember, in your search for co-builders and models, you want to develop the most efficient and elegant approach to the issue which you are attempting to address. Co-building social transformation. Fusion of frameworks. This is an example of how to fuse frameworks that bring into focus the pathway from visioning to implementation, evaluation, and revising the project. Co-building social and economic transformation requires careful reflection on the elements and necessary components of social transformation. In this case, we are looking at two maps. You may have a situation where you need several roadmaps that fuse together will assure an adequate transformation. In holistic practice, it becomes clear that social and economic transformation are two parts of an effective solution to community problems. I purposely left one off in this example to point out how it is important to always search for gaps in services. This can be accomplished by viewing the situation from two lenses, either from the parts to the whole at one point or whole to the parts. Both lenses help bring about gaps that we may be missing, and always keeping in mind the big R and small r components of social and economic transformation. This is the CARE framework that we have been discussing. It is important to realize that a macro approach depicts the steps of a process towards transformation and sustainability. Note that the process is circular. We kind of go around and then we come back in terms of the approach. When evaluation and reassessment take place, then re-engagement of the stakeholders begins the new cycle, further revising and adding new services. Whether you use CARE as a template or not, it is important to find a sustainable process within which to travel through the transformation each time. The suicide prevention model is a micro approach that focuses on assisting individuals who are at risk for self-harm leading to suicide. The CARE model is a process model, and this is a treatment or individually focused model that will be, in a moment we'll show how to fuse that. But basically the components of this model have to do with this identifying and assisting individuals, increasing help-seeking behavior, effective care and treatment, care transitions and linkages. This is very important because follow-up is critical. You can treat at one point, but if not following up to ensure reinforcement of what one has learned, it sometimes fails and you have people repeating the cycle. Again, responding to individual crises, post-vention work, reduce access to means. That is the important piece, that people not have means to the sources of self-harm. Life skills and resilience, of course, are follow-up elements of this, which also may involve some kind of economic twist. And then this sense of connectedness, social support. So these would be elements of the micro process that would be involved in this transformation effort. Co-building by weaving key services with the care framework. In this image, we examine co-building by weaving the key services. Here we see what we might call the fusion of process and practice. We'll note that based on the micro elements here fused in with the macro elements, for instance, identify and assist the individual, this would develop from process set forth looking at assets and strengths within the community and also the planning and intervention. Increasing self-seeking behaviors would also become part of this implementation of the process, as well as the care and transformation linkages. Responding to the crisis would also involve the planning and intervention element. Post-vention, of course, is the evaluation and reassessment kind of thinking that would go on in this process. Then reducing access to means to harm, certainly part of the implementation, but also evaluating the success of that and how that might change as an example. Then, of course, life skills and resilience come both in the implementation plan that leads to inpatient, outpatient, and follow-up levels of services. And then this connectedness element would have to do with, again, the implementation, but also re-engaging residents may involve those who have themselves been recipients of the services offered by the particular project. So this looks very complex, but one needs to weave together in this case a micro and a macro process, the process and the services, and then moving then to the assessment phase or during this process. Again, this has focused on social transformation. However, a serious gap here is in the economic element that requires attention. You may have success with treatment where meaning and purpose becomes more clear to those who have worked with the program, but then the economic transformation is something that must take place in order to ensure the ability for people to live in a comfortable manner and not recidivate in terms of having further crises in terms of self-harm related issues. So during the process of developing the project initially, or in this current iteration of the transformation on the reassessment phase, or in the reassessment phase where the cycle begins again, transformation is not a one-time event, by the way. It suggests an ongoing effort. That is why the process model, such as CARE, is necessary to set steps forth where they sustain an ongoing evolvement of programming. During or when health and mental health concerns are addressed initially, the economic component needs to be examined. In this image, we are reminded also that co-building sometimes includes a range of companions.